probably the most satisfying part of my job is really seeing the broader community service that we provide across the region. And we have an opportunity at Hudson Headwaters to really do it on a regional scale, which is pretty exceptional. Now we have a presence in a lot of towns and a lot of places, and that is a great opportunity to learn, what are the needs there and what we can do for those folks in those towns, and really try to advocate for those needs as well.
There's a lot of diversity in the patients that we see, coming from more urban areas and coming from very rural areas. Once they come to Hudson Headwaters, though, we treat them all the same, and our goal is to address their personal health care needs regardless of their ability to pay or where they come from.
My favorite part of the network is my relationship with the doctors, because I know that at any moment in time I can have access to good, important health care. There are very few places in the country that have this kind of ability, and for us to have that in this community, for any resident to be able to walk in on a sliding scale and get the kind of service that they would dream of, and the capability of the doctors within the network to provide this service is unique.
Really have numerous public health and community-based organization partners that we interact with on every day, and so we have probably more relationships in more directions than we ever have, but that's been a great thing, and I think still has not reached its full potential yet, so we'll continue to work hard at those relationships and see where they lead.
I do believe that we're in a magical area in which to live. I think that this area is the sweet spot of accessibility to suburban amenities and rural opportunities.
Education is a very, very important aspect of healthcare. And I think that as we educate our people and give them more access to healthcare, there are many, many dividends to come from that. Primarily, the dividend is education, it's job creation, it's high-paying jobs, it's greater training, and access. All of these items are the background to the success of Hudson Headwaters.
The relationship you had with the patients and the amount of time you could spend learning about their families and learning the interactions in their town and their problems and stuff. That was essential in helping them get better or stay well.
If we were to disappear, it would be the same impact that we were facing, or our communities were facing 45 years ago. And that is, if you lose your doctor, you obviously lose the drugstore. But if you lose the doctor and everybody has to leave town to see the doctor, well, they buy their groceries too because it's a little cheaper and the stores are bigger. And that's where they buy their gasoline. And pretty soon there's no financial, economic center to the community. And so, and also, many people don't choose to live or can't bear to live in a community without medical services.
While there are other medical providers in the area, there's simply not enough to instantly assume the care of all these patients. So if that truly happened, you'd have more than 50% of the patients in this region without a physician or provider of any kind. It would be a massive problem, and maybe immediately it wouldn't be felt, but over years, if you didn't replace that healthcare, you'd see out-migration. People would likely leave for other places to live.
Hudson Headwaters is here to stay because the community is built around healthcare. It's built upon job creation. It's built upon higher wages, and it's built upon the development of an infrastructure. All of these things are necessary for the Adirondacks to be the kind of place that we need it to be.
Hudson Headwaters plays a vital role in the North Country and in the southern region. So we currently are in many, many rural areas where we are the only provider in that town with physicians that retired years ago. If Hudson Headwaters were to leave this area, it would be very devastating to our patients and to the staff that work here. Hudson Headwaters is known to being committed and to stand behind its mission statement, and I believe that the staff and patients that live and go here are an example of what a fine organization this is, and Hudson Headwaters not being around would leave a huge hole.